Hi everyone, welcome to CPAP 101, the CPAP beginner's guide. So if you're watching this video, you've probably been diagnosed with sleep apnea and you need a CPAP machine. So where do you start? Well, first of all, there are three main brands. There is ResMed, Fisher & Paykel, and Phillips Respironics. Now ResMed, in our opinion, and most people's opinions, is the biggest and most reliable of brands. Their products are very well built. Everyone knows the ResMed products. There are a few different machines that you're going to want to look for. The AirSense 11, which is this guy here, and it has the touch interface. The AirSense 10 with the dial and button interface, and then the Air Mini, which is the small travel version that doesn't have a humidity chamber like this. It uses humidity in a different way. Okay, and the next brand is Phillips Respironics. Phillips used to be a huge name in the CPAP industry. Their Dream Station was one of the best CPAP machines on the market. However, the Dream Station 1, it turned out it had foam inside of it. People call it foam gate, and the foam was giving patients cancer at high rates. It was a toxic, cancerous foam. So as you can imagine, all of those machines got recalled. Because of that, they had to come out with a new machine. So they slapped a new machine together. They had it, the Dream Station 2, the savings grace. Now, a couple weeks ago, it came out that the Dream Station 2 is catching on fire. It's overheating and basically is a little bit of a firecracker next to your bed. So we don't sell either machine. We don't sell the toxic machine and we don't sell the fireball machine. And that's why we kind of stick to ResMed at the cpapstore.ca. Now, Phillips and ResMed both make masks, and we'll talk about that later, which leads us to our third company, Fisher & Paykel, or FMP. FMP does not make a machine. You'll see machines on the internet, but I don't know if they still manufacture them, like they're never in stock, but they do make masks, and they make some of the more innovative masks on the market. We really like FMP masks as well. Now, parts of your CPAP system is going to be the machine itself. It's going to be your tube, okay, just like this, and that connects on the back of the machine. So here we have the tube connector. Put that on the back there. And then we have any mask. So I'm going to take a Fisher & Paykel mask. This is a Vitara, and we're going to put that at the top here. So you might be asking yourself, how does this FMP mask work with the ResMed machines? All machines and masks are universal, so that is basically why it works. So you don't worry if you went to the store and you have a Philips Dream Station mask that you want to buy, but you're a little scared of the machines and you want to buy a ResMed machine, the mask will work with the machine and the tube, no problem. However, that's not the same with tubes. Make sure that whatever tube you buy, whether it's your branded tube or a third-party tube, is going to be working specifically with your machine. Now, all of these are required for CPAP therapy, but are there any accessories that I would like to mention? Yes, there are. The first one is a tube hook. So it looks like this. This is a tube hook by CPAPology. Now, you don't need to buy a CPAP tube hook. I have a whole video, I'll link it down below, on tube hooks and why we use them. But basically you put the tube in here and it's gonna keep the weight of the tube off of your face. So you'll notice when you first start CPAP therapy, you're gonna have a lot of tube drag, the tube getting caught in the pillow and stuff like that. It'll be rather annoying. A tube hook, or just any hook that you buy from a hardware store that you put on next to your bedstand, will work in keeping the tube a little out of your face and minimizing that tube drag. The next accessory that I really like is little brushes like this. Okay, specifically this tube brush, also from CPAPology. I'm gonna take it out, it's brand new, this guy here. And as you can see, it's a big, long brush that you can push through your CPAP tube to clean it. It's really important that you keep your CPAP equipment clean, and the tube is probably the trickiest portion, so a tube brush really comes in handy in keeping it clean. The last accessory that I kind of want to talk about, again, not required, there's tons of accessories that we can talk about. I can make a whole video on accessories itself. Just want to talk on my top few here, but the last one would be a CPAP battery or a CPAP power bank. This is important if you live in a country or an area with frequent and constant power outages. If you do live in a place like this, I definitely recommend getting either a battery or a battery/power supply. Next thing we're going to be talking about is cleaning. So how do you clean everything in your CPAP system? So in terms of your daily cleaning regimen, I just recommend CPAP wipes. These are some easy peasy CPAP wipes. And you're going to just want to take a wipe, antibacterial wipe, disinfectant wipe, and wipe out every crevice of your CPAP mask every day. You want to do that right after bed, just so your CPAP mask is smelling clean and it is clean every time you use it. You don't want bacteria and things building up, especially in these little nooks and crannies. There's quite a few illnesses that can cause just bacteria build up over time, biofilm build up over time. You don't want that. So just make sure that you're wiping down your mask and stuff every day. Now, in terms of your weekly cleaning, you want to be deep cleaning your mask, your tube, and your CPAP machine, aka mainly the CPAP chamber, water chamber. And you're going to be using vinegar or dish soap to do that. I have a video on cleaning. I'll put it down below. Basically rinsing everything out, letting it soak, wiping it nice and dry, and then letting everything dry nicely there. Cleaning your tube with a tube brush and then drying it out using the CPAP machine. Just make sure you're doing that once a week, and then doing your little daily wipes with some citrus disinfectant wipes every day. Now we're going to be talking about pressures. So you need to know a few things in terms of your CPAP machine. We have my options and my sleep view. Your my sleep view is kind of like your sleep report, okay? And then your options are your options. Now, depending on your doctor, depending on your sleep therapist, they're gonna have different options that they're gonna give you in your CPAP machine here. Ramp time, humidity level, so certain things that you can change. So ramp time is how fast or how long it takes for your CPAP machine to get to your required pressure. For example, if you are prescribed pressure of 10 and it always starts off at a 4 pressure, if you have a 10 as in 10-minute ramp time, it's going to take 10 minutes from you to start your CPAP at 4 pressure and then go to your 10. So that's just the amount of time it takes to get to the prescribed pressure and slowly ease into that. Your humidity level goes from 1 to 8. On the AirSense 11, basically how much humidity you want. If you're noticing that you're getting quite a few raindrops in your tube, that's called rainout, and you can look up how to reduce rainout. But one way to reduce rainout is to slightly decrease your humidity, okay? Now we have mask settings. If we want to go click mask settings, full face, pillow, and nasal, different types of masks. We're going to talk about that in a minute as well. And basically, yeah, you can go through your options. It's going to vary person by person depending on what your doctor allow you to view. Now, say you live in a remote location or you can't access a doctor, or you get the okay from your doctor to change some settings in your CPAP machine. You can take 2 fingers, put them on these buttons here. You're going to get into the clinical menu. And now we can change things in the CPAP machine. We have the mode for CPAP. We have set it pressure. So we have a pressure of 18, fairly high pressure. The average is around 10-ish. But your doctor, we're going to give you a pressure that works for you. And again, you can change ramp time, start pressure, stuff like that. EPR is your expiratory pressure relief. So that means how much pressure it's going to dip down to when you are exhaling. So for example, if you had a prescribed pressure of 10 and you set your EPR on, let's see, full time to a level 3, that means when you're exhaling, the machine's gonna notice that and it's only gonna feed you a pressure of 7, right? 10 minus 7. And that's gonna allow you to exhale a little bit more. So that's how you get into your clinical menu. And the reason why I mainly want to talk about this is because of your pressure, which is at the very top here. We click that, we have our CPAP pressure, 4 to 20 centimeters of water pressure. Now, if you are starting CPAP, you might want to ask your doctor if you can start at a lower pressure. It's going to take a decent amount of time before your lungs and your body are used to exhaling and pushing out that pressure. And it's like doing anything for the first time. Going to the gym for the first time, writing for the first time, painting for the first time. You're not going to be very good at it. You're not going to be very used to it when you first start. So I recommend definitely starting at a lower pressure just so your body gets used to it. That takes about a week, and then you can go to your prescribed pressure. But definitely talk to your doctor before you start changing around the pressures. Okay, we're going to go back home, and to start the CPAP machine, you just press the power on button. As you can see, it's starting up. And you can probably hear it starting up. Now let's talk about masks. There are quite a few different masks, as we saw when we were looking at our CPAP machine here. You can see, I'll go back to the home menu, exit the clinical. There's mask settings, nasal, pillow, and full face. Nasal masks are masks that go on your nose, generally on top of your nose, such as the AirTouch by ResMed. It goes on top of your nose just like that. The next type of mask is the pillow mask, such as the P10, very small mask. I'll put a picture there so you can see what the pillows look like And basically those little pillows go underneath your nose and they kind of seal off, okay? They're very similar to the AirFit N30i, which is a cradle mask, which is the same thing, but without the pillows. That just goes right under there, okay? Generally, a pillow mask is gonna seal a little bit better because there's that extra little bit of silicone, aka the pillow, that wraps on the inside of the nasal cavity. However, that being said, it doesn't go up your nose, it just kind of goes like the first millimeter / eighth of an inch into your nose, but it definitely doesn't go in your nose. So if you're worried about it going into your nose, it's more pressed up against your nose and seals around. Now, the last type of mask is the full face mask. Goes around the nose and the mouth. There are hybrid full face masks, which goes around the mouth and then just the bottom, kind of like the cradle. I won't recommend those for people just starting out because they're a little bit trickier to get right and a little bit trickier in terms of leaks and stuff like that. Now, everyone is going to have a different face, so you need to try different masks. If you have a CPAP mask, you're hating CPAP because it's leaking, it's blowing, it doesn't feel comfortable, just try a different mask and it could totally change your CPAP experience. Another thing I would like to note is Fisher & Paykel always make their masks with clips. So if you do have pacemakers or something that can't be close to magnets, I definitely recommend Fisher & Paykel masks because most ResMed masks and Phillips masks are using magnets. Last thing about masks is I would recommend having a relief mask. So once you find your first mask that you really like, for example, say you have a nasal mask like this that you really like, I would go and try to find a full face mask or a really different mask that you also like. So for me, I would probably, in this example, say I'm using the N30i by ResMed, I would go with a Fisher & Paykel Vitaira because they're very different. Why? Why is it important to have a second mask, or why is it important to have a relief mask? Well, when you first start CPAP, you're gonna notice a lot of red marks, a lot of maybe uncomfortable areas in your face, maybe like a tiny little rash here and there. And that is because you have the moisture and the silicone on your face all night long. It's gonna be a little bit uncomfortable for your skin to toughen up. And so if you get two different masks, such as these two cushion designs here, I can put this under my nose and it's good under my nose. And after 1 or 2 days, I'm probably gonna get a little soreness, a little red under my nose. And then I can switch to a full face, which doesn't touch the underside of my nose whatsoever. And therefore we recommend having a relief mask, especially if you're starting out, just so your skin doesn't get as irritated when you're starting it and make you want to quit CPAP. I hope this video helped you start your CPAP journey. If you have any questions, leave them down below. I'll do my best on answering them, or our fellow CPAPper friends will answer them. There's always some great people in the comments answering questions, and we really appreciate that. So if you know the answer to any of people's questions, write your thoughts and opinions to help them out. Okay, take care guys, see you later.